We're the Commercialization Center for BioMark at the Health Tech Innovation Center. Just across me here is the Surrey Hospital, one of the busiest hospitals in Canada. Our technology obviously means a lot to different people, but to us it's really about providing patient life-saving mechanism. Surrey is becoming a nexus here for healthcare provisioning across Canada, so it's the perfect zone for us to be in.
And it's just a walk across the street to meet the people at the BC Cancer Research Agency who are enthusiastically embracing us in terms of our technology and our brand and the work that we're doing with the very good oncologists such as Dr. James Bond.
Our brand is about saving lives, and it's a privilege for us to be working with oncologists and patients and healthcare providers in developing our next disruptive technology on biomarkers. We're at the Surrey Memorial Hospital, and this morning we're going to be going to witness surgical intervention for lung cancer with Dr. James Bond. One of the key things that we're going to be witnessing is how we take our technology from bench all the way to a patient bedside, so B to B.
Well, we know that if we find lung cancer early, patients have a much better chance of survival, and we know that because we're finding people earlier. Not so much because we have better screening programs, although those are coming, but because we're finding a lot more disease serendipitously during investigations for other problems. So X-rays or CAT scans done for reasons that had nothing to do with with knowing that they had lung cancer at risk for it. It's just found by accident. It's considered one of the biggest killers from cancer, so it's the most common cause of death with cancer. We used to think that the incidence of smoking was falling. We're not so sure about that now. Young people taking up smoking with more vigor. BioMark technology is looking at a marker that would be very unique to a cancer, in this case hopefully a lung cancer. We give the patient a drug, and it interacts with the body in a unique way that creates markers in a blood test that are unique to a cancer. In this case, lung cancer is what we're specifically looking at. So that changed things a lot if we were able to find people with early cancers or even slightly less than early cancers. Ideally, if we had testing that allowed us to identify cancers with less hoopla and less other diagnostics, especially more expensive ones like blood tests or other modalities, that would allow us to save even more time and of course a whole lot of cost, but also a lot of patients, we take them to the operating room and we make the diagnosis clinically before we get them, but we confirm it in the operating room. It would be nice to be able to have a test that we could be very solidly confirming a diagnosis before we get to the operating room. Once we've established that it works, then the next step would be to create programs where patients who are at risk, smokers, previous cancers, would get screened with, say, annual or semi-annual blood tests, as opposed to very expensive radiology, which has lesser access. And maybe we get to a point where you have point-of-care testing, where a patient uses an iPhone app and a single blood stick that they can measure their levels, and then they can, over, say, the course of 2 years or 3 years, they monitor their levels, and it suddenly goes up, and they say, "Oh, I better go see my doctor. I've got an elevated level. It's time to go check." Much like a PSA test that people know it's used for prostate cancer. So it becomes a marker of risk, and then you start doing more expensive invasive diagnostics and testing. But it also could be used in the same way by patients who have lung cancer as a much more sensitive tool for early recognition of recurrence or persistent disease.